Hi, I'm Dr. Liam Donaldson, Department Head of Emergency and Critical Care at CityU Veterinary Medical Centre. CityU Veterinary Medical Centre is proud to open our Respiratory Care Unit. Rescue offers the highest standard of care for the pets of Hong Kong, as demonstrated by a recent certification as a Veterinary Emergency and Critical Care Society clinic. Rescue is a collaboration of specialists in critical care, internal medicine, surgery, neurology, anaesthesia, as well as our 24-hour emergency team. We're able to provide constant around-the-clock care for patients that present to us in respiratory distress. We have 2 mechanical ventilators, high-flow oxygen therapy, temperature and humidity controlled oxygen cages, as well as access to digital radiography, CT and MRI. In addition to that, we have the most experienced nursing team that Hong Kong has to offer. Given this increased standard of care that we can now offer, we've identified that the pets of Hong Kong desperately need a respiratory care unit or rescue to provide that care when they present to us with respiratory conditions, difficulty breathing, or underlying heart disease. Through a multidisciplinary approach, our team comes together to provide the highest quality of care for not only the pets of Hong Kong, but also for their families.
Hi, my name is Dr. Duana McBride, and I'm one of the Emergency and Critical Care Specialists here at CityU VMC. We're here at Rescue, which is our dedicated intensive care unit for our respiratory patients. Here we treat patients who've got severe respiratory needs, for example, BOAS patients or any patients who have got respiratory distress. In our rescue unit, we've got 2 state-of-the-art CityU mechanical ventilators, as you can see. And one of the benefits of the mechanical ventilator is we can provide 100% oxygen to patients who are really critical in severe respiratory distress, where standard oxygen therapy is not enough for them. And what we can do with the mechanical ventilation, or what we call life support for our patients, as we can provide 100% oxygen and provide the comfort by providing general anaesthesia to our patients at the same time. So we tend to put our really critical patients on these machines. So for example, dogs with really bad pneumonia, dogs and cats with heart failure, and also brachycephalic dogs like BOAS dogs such as French bulldogs who often have respiratory problems. One of the other benefits of the CityU mechanical ventilator is it provides another function, and the other function is what we call high flow nasal oxygen. And I can demonstrate on this mannequin here. We can then attach these special nasal prongs dedicated for high flow nasal oxygen. And the benefit of this is that we don't need to anaesthetize a patient, and we're providing extra pressure and extra oxygen through these. And it provides much less respiratory distress in patients compared to other methods of providing oxygen to our patients. In the rescue unit, we have these oxygen boxes here. And one of the benefits of these oxygen boxes, it's really ideal for our really stressed patients who are in respiratory distress, because it provides up to 80% oxygen. We can control the humidity and the temperature, and also helps with patients who have high carbon dioxide levels, as it can scavenge carbon dioxide. The unit has also got little holes, so we can provide intravenous fluid therapy or any intravenous drugs without handling the patients too much. It has excellent visibility with the lights here, as you can see. And if we do need to handle our patients and don't want to lose too much oxygen, we can use these little circular units to access our patients. So it's really ideal for our critical patients who requires a lot of monitoring, some treatment, but minimizes stress to them.
Hi, I'm Dr. Jamie Fu, one of the surgeons here in CityU VMC. As a surgeon, I see a lot of respiratory patients, such as ones with brachycephalic airway syndrome, airway digestive disease, and laryngeal paralysis, just to name a few. There are various surgical procedures that can help alleviate these patients' clinical signs, not only to improve their airway noise, but to allow them to exercise, reduce the risk of heat stroke, and let them live their life to the fullest, not needing to gasp for air all the time. But these are major procedures, and they come with significant complication that needs to be managed appropriately. I'm honored to be able to work alongside Dr. Liam and Dr. Duana as leaders of the Respiratory Care Unit. Having the ability to have my patients looked after by highly experienced and highly specialized vets fills me with confidence, and I believe this is the best chance for our patients to have the best outcome.
我係 Joseph， 咁呢度深切治療部嘅護士之一。 喺創傷科層面，機械式嘅呼吸機其實我哋係可以應用於好多氣管上邊、肺部上邊創傷科嘅 case。喺照顧嘅層面咧，其實係一個全天候護理嚟嘅。咁我哋每個鐘頭亦都必須要有一個定時嘅呢個維生指標嘅記錄啦。咁亦都需要對病人有個24小時無間斷嘅觀察同埋監測。咁包括佢哋個維生情況啦、佢哋個消毒情況啦，我哋都係全天候貼身嘅一個照顧嚟嘅。咁包括可能每2個鐘頭需要吸痰啦，每24個小時需要換喉啦。咁喺全部過程當中，基本上我哋接近喺一個無菌嘅狀態下去維持生命同埋佢哋個照顧嘅。機械式嘅呼吸機喺急性肺部疾病或者創傷科嘅胸肺問題，其實會有一個直接同埋有效嘅治癒效果，可以拯救到佢嘅生命。